The Wellcome Centre for Ethics and Humanities is a really exciting place to work, and it's partly exciting because we're at such a time of technological and social change, and the centre is taking that seriously. So changes in the way the world is connected, global connectedness, changes in data science, how our data is collected and used, changes in genomics, genetics and medicine, and also changes in the ways in which we understand the way the human brain works. And if we think about how all those things come together, we're at a time of really exciting social change, and that presents opportunities and opens new avenues for the future, but it also presents a number of ethical challenges and moral challenges that we need to face as a society. And so the centre is a place where we, a group of researchers of various kinds, we take that seriously, and we're engaged in this really exciting set of discussions about those problems.
So the bits of the play that relate to my research are the pieces about pandemics, about antibiotic resistance, and about health inequities, so richer and poorer nations having access to drugs and vaccines.
I have been working primarily on the ethics of vaccination and vaccination policy, and more in general on the ethics and policy making around infectious diseases, which raise a lot of ethical questions about individual responsibility, collective responsibility, state responsibility, and ultimately about our moral obligation to make a fair contribution to society's level of public health. But I've also been working recently on other areas within healthcare ethics, specifically about the use of artificial intelligence in healthcare and in mental health care. And I'm working also on conscientious objection in medicine. That is when doctors or healthcare professionals do not want to engage in certain activities because of their own moral concerns, for example, abortion.
Some things that you may have noticed in the script to the play is references to Naples and disease in Naples and the population living underground. That stems from my research at the moment, which is on the population of the city of Naples in the Second World War, who were forced to live underground for many months to avoid Allied bombing. And while they were underground, they also became susceptible to infectious disease. And Naples was one of the scenes of a terrible epidemic of typhus during World War II.
My own research interests are in global health and in the uses of data, surveillance, and other forms of technology to understand and engage with the health problems that arise at a global level. Pandemics, for example, the movement of people, and the ways in which those kinds of problems can be understood, predicted, and hopefully prevented using, for example, surveillance. And that's a great opportunity. It's really interesting and exciting, but of course we have to think carefully about how we collect that data, the responsibilities we have to the people that we collect data from, and how we work together as a world to solve problems that can only be solved by collective action.
My research is on the ethics of research partnerships in mental health research. One of the things I'm trying to explore is ethical challenges when stakeholders in mental health research are involved in the same project. The way research is done today has changed compared to the past, so patients are now encouraged to have a more active role in research. That's because of the new perspectives and insights they bring to research based on their personal experience. And it is assumed that this will improve the quality of research and make the results more relevant for those in need. At the same time, mental health research is underfunded, and much of that research needs to be sponsored by pharmaceutical companies. So when academic researchers, patients, and representatives of pharmaceutical companies are involved in the same project, they might not necessarily have the same interests. They might have competing research agendas and priorities, and different views about research methodology, how the results of the study should be disseminated, or even what counts as valuable research.
There is a reference in the play to the bodies of ex-soldiers that have been modified for war with the introduction of weapons onto their limbs. That stems from my work at the moment on human enhancement and the history of human enhancement and body modification, and the ways that the militaries over time have tried to modify the human body in order to make it more controllable and more effective at waging war. These are healthy bodies that have been modified for war purposes.
Developments in science and technology, of course, come with challenges and risks that they should be assessed and addressed. But at the same time, the open opportunities on how we see the world, how we see ourselves or our relationships with other people, which also means that we probably need to revisit our own values and ethical systems and think about what we need to change, what we need to improve to make the world a better place.
I think we should be a bit more positive about the future prospects with regard to public health ethics and to vaccination specifically. One line of research that I've been pushing in the last years is one about compulsory vaccination. I think there is a strong case for compulsory vaccination. But when people think about things like compulsion or state coercion, they pick this sort of scary futuristic scenarios, sort of a bleak future. I don't think that concern is warranted, because it's true that coercion itself is often taken to be a bad thing, but in this case coercion works for the good of everyone. So if everyone gets vaccinated, and it is likely that in the future we will find more vaccines for more diseases. For example, the coronavirus, at the moment there is no vaccine for that, but if there was a vaccine and if people were forced to be vaccinated, we wouldn't have this global public health emergency. So I think that there is some downside in using state coercion, but I think we should be more positive and more optimistic about the future, because coercive vaccination policies and coercive public health policies, if properly implemented, can benefit everyone, and the downside is really minimal.
So the show talks a lot about an impending apocalypse and pandemics and infectious disease, but my research is actually focused on technologies that have the potential to prevent that and to help us to understand how infectious disease is moving and to stop it in its tracks.
Some of the play does seem somewhat bleak, but I think what's important to remember, and certainly as a historian you're very aware of this, is that the future is there to be determined. We can't predict it. So although some of the modifications and some of the subject areas that are touched on in the play can be quite grim and may conjure a kind of apocalyptic vision, we should remember that that's not necessarily the future that lies ahead.
If you're an audience member and have been to see The Time Machine, we'd be delighted to hear from you to get your thoughts and feedback on the experience that you've had. So please do get in touch with us either through our website or through our email address. But also we might reach out to you and ask a few questions about how you felt about the play and if you have any comments that you'd like to give us. So thank you.